At the beginning of this year, 27-year-old Zachary Meyer got an opportunity he'd only dreamed of.
Doing oil field simulators is the dream job. That's what I've been wanting to do for so long.
But as COVID took hold around the world, things quickly changed. By April, Meyer had been furloughed. 2 months later, he was laid off.
This is supposed to be a great year. And then it was June, and I don't have a job anymore.
Meyer joined the millions of Americans who have lost not only their jobs, but also their health insurance.
I chose to not do COBRA, and I haven't looked at getting on Medicare because it's more important to me to kind of have that money in the bank to pay bills for making sure we have food in the pantry.
He hopes to find a job soon to restore his health insurance. But with no prospects in sight, Meyer says he's prepared to forego coverage, even during a pandemic.
I haven't gotten, a physical this year. I haven't gone to see a doctor. I'm not talking with anyone about my health for the future.
New data suggests up to 7.7 million Americans lost insurance during the depths of the pandemic's recession. Factor in dependents, and that number nearly doubles. While many benefits will come back with jobs, we're only about halfway recovered. Experts who work with the newly uninsured say many never imagined they'd be in this situation.
All of a sudden, we're seeing lots of middle-class people who are finding themselves without a benefit they've had historically navigate what can be a very confusing time at a time when you're already distressed because we're living in a pandemic and you've lost your job and your insurance.
Elena Marks is the CEO of the Episcopal Health Foundation in Texas. Texas had the highest rate of uninsured people in the country before COVID-19 and is one of only a dozen states that hasn't expanded Medicaid. Marks says the influx of newly uninsured patients could place even more strain on already strapped healthcare systems.
At some point, if they don't have paying customers, they will go out of business. You cannot do it forever for free.
While some can afford to go without insurance, for those with pre-existing conditions, like Sean Smith in Georgia, losing insurance during a pandemic is more complicated.
I lost my job about 3 weeks ago, and that was part of the reason why I took the job I took, was because of the health insurance portion of it.
Smith has a weakened immune system and eats all of his meals through a feeding tube called TPN. He tested positive for COVID 3 times between March and July and spent the summer in and out of the hospital.
Did you ever think you would be in this situation where you lost your health insurance coverage?
No, never. It freaked me out because I knew that I wouldn't have access to my TPN. I wouldn't have access to the doctors who knew my situation and have been working with me for the last 3 years. So that was the scariest part for me. I wasn't even thinking about how would I be able to pay rent or anything like that. It was more so really all about, because if you don't have your health, you really don't have anything.
Smith has since enrolled in a plan through the ACA marketplace, but worries about what could happen when the Supreme Court takes up a challenge to the law next month.
They can get rid of everything within a few days after the election, and then I won't have access to my policy anymore. Because no one's going to take me with the pre-existing conditions that I do have. From what I understand, next year in the state of Georgia, they want to get rid of it anyway.
In recent weeks, Georgia's Governor Brian Kemp was granted a waiver that will expand Medicaid coverage for some people who meet work requirements, but allows the state to block access to healthcare.gov, instead referring customers to private companies and local brokers. That change kicks in next year.
What's really got me discouraged about hearing all this, we're going to protect pre-existing conditions. I haven't seen any bills that have come out of the opponents of the ACA that actually do that in a way that is financially feasible.
Republicans and Democrats and even the president have said they want to do things to help make the healthcare system better. And it's been 3.5 years and they still have not done it yet. So I wish that they can put politics to the side and understand that when they play politics, they're playing with people's lives.
A sentiment that rings especially true for those navigating a pandemic without health insurance.
I'm not going to be able to go to the emergency room without worrying about having cash on hand.
So what happens if you get sick? What happens if you get COVID?
I sit in the spare bedroom upstairs and I get a bunch of Theraflu.
Because of a so-called trade war with China, America lost 300,000 manufacturing jobs. Farmers have experienced bankruptcy because of it. We are in a manufacturing recession because of it. And when we look at where this administration has been, there are estimates that by the end of the term of this administration, they will have lost more jobs than almost any other presidential administration.
When Joe Biden was vice president, we lost 200,000 manufacturing jobs, and President Obama said they were never coming back. He said we needed a magic wand to bring them back.
So that's the rhetoric from both presidential campaigns on manufacturing. But what's the reality around this issue? Senator Harris said that the U.S. was in a manufacturing recession as a result of the trade war with China. Here's what happened. After a year of robust manufacturing growth in 2018, the trade war with China ramped up, and 2019 did see a dip, a slight recession in America's manufacturing sector.
The president is really in danger of engineering a global, manufacturing recession.
Harris's other point, that the Trump administration, quote, will have lost more jobs than any other presidential administration, is also looking like it will be true. No other president has left office with fewer total American jobs than when he took office, at least since 1939, and Trump is on track. But the cause of this is not really the trade war, it's the pandemic. So the rhetoric doesn't exactly match the reality here. The pandemic has also thrown a wrench in some Republican talking points.
They said it would take a miracle to bring back manufacturing. I brought back 700,000 jobs.
The reality is that manufacturing grew about 500,000 jobs over the first 3 years of Trump's term. But the COVID recession has resulted in job losses outnumbering the gains. He goes on.
They brought back nothing. They gave up on manufacturing.
So did the Obama administration really give up on manufacturing? And what about Pence's claim that the Obama-Biden administration lost 200,000 manufacturing jobs? According to the Bureau of Labor Statistics, there was a net loss of about 192,000 manufacturing jobs across Obama's terms. But the numbers show that most of the jobs lost during Obama's presidency were a result of the recession he inherited. In 2010, employment in the manufacturing sector started rising again and continued to do so with some bumps in the road until 2016. The Trump administration has tried to use the pandemic to make the case that manufacturers should bring their businesses back to the U.S.
The global pandemic has proven once and for all that to be a strong nation, America must be a manufacturing nation. We are bringing it back.
But that's not exactly what's happening. According to a July survey, more than half of U.S. companies reported being more willing to invest in automation thanks to the coronavirus.
Well, we forecasted an acceleration of automation in the pandemic, and there are spikes in automation during downturns. That has been shown empirically in the last several recessions, and there's a lot of reporting showing that it's happening again. If you think there are always pressures on price and the cost of labor, add to those questions about social distancing on even the shop floor, and you really are talking about a real spur to further automation.
Of course, the well-being of the industry, and particularly the people it employs, will have a huge impact on voters in the Midwest. So we've given you the numbers, the results from the last two administrations. But a vote for the future could come down to which approach voters believe works. Biden's focus on investment and innovation, or Trump's focus on China.
It's very clear that both campaigns are extremely alert to the huge manufacturing legacies in Pennsylvania, Wisconsin, Michigan, Ohio. But I think it really explains why manufacturing, that is only, like 9% of jobs in America, looms so large in political discussions, because it is a much larger share of those states' economies. Blue-collar and former blue-collar workers can't be in a great mood, though, given what is happening in the manufacturing sector right now. Whether that translates into changes on voting behavior, we don't know.
Suburban white women helped President Trump win Pennsylvania back in 2016. But the latest polling from CNN shows former Vice President Biden ahead of President Trump by 10 points in that state. The president himself making a plea to suburban women to please like him. So why are white suburban women swinging from Trump to Biden? NBC's Heidi Priscilla joins us now from Hershey, Pennsylvania. Heidi, what does the president have to say? What does the president have to do to swing this group of voters?
Yeah, Ellison, how exactly did Trump lose the popular vote in 2016 but win the Electoral College? It was because white women in leafy suburbs like this and a handful of states in that blue wall pulled him across the finish line. So it's no surprise that he is now literally coming to these states and pleading with him to support him again. You saw in that Quinnipiac poll a huge swing from 2016 when he won white women by a slight majority. But now white women in this state are supporting Joe Biden by about 10 points. We walked yesterday up and down Chocolate Avenue behind me, and to a T, we talked to a lot of these suburban women. They said they just want all of this to be over with. A lot of them never liked Donald Trump personally from the beginning, but when did the bottom really fall out? It fell out with COVID affecting them in ways that are somewhat disproportionate to men, in that they are administering virtual homeschool. They're caring for sick parents or having their parents pass away. And so that is something that suburban women tell me is really when the bottom fell out, in addition to his debate performance, Ellison.
Heidi, you spoke to a woman who voted for President Trump in 2016 but says she's now on the fence. What is she looking for from the president in tonight's debate?
Right. To put it bluntly, she called his last debate performance abhorrent, Ellison. We spoke yesterday with 37-year-old Lisa Brackbill. She is a lifelong Republican who, for the first time, she's never voted for a Democrat, for the first time, is really perplexed about what she should do, whether she should vote Democrat for the first time. Take a listen to what she had to say when we sat down with her yesterday.
I'm definitely going to vote. Absolutely, 100%. I guess I just keep waiting for something from either candidate to just be enough to sway me one way or the other. I honestly would probably feel best with my conscience in voting third party, which I know also is kind of risky. A lot of people consider it to be risky. So I just keep waiting and hoping. So maybe something in the debate, now that they can be muted, maybe something will happen that I can say, okay, I can feel good in my conscience with voting for you.
So, Ellison, Brackbill also talked about the stigma and pressure that comes with being in such a strong Trump-supporting area and having these impure thoughts that she's having about voting for a Democrat. And that was a problem that we encountered with a lot of these women. But I've also been listening in on their focus groups, and many of them, after that debate, were considering pulling the lever for Biden. And that's why the polls are showing this big swing.
Heidi, so fascinating to hear her thoughts on the tough decision she has to make and what she's watching for tonight. Heidi, thank you.